Okay, I'm Massimo Mischi. I'm an associate professor at the Eindhoven University of Technology in the Netherlands in the group of signal processing systems.
My name is Hessel Wijkstra and I'm working in the Department of Urology in the AMC University Hospital in Amsterdam, and at the same time I'm a part-time professor in Eindhoven and working together with Massimo.
Well, I did my Ph.D. in the area of contrast-enhanced ultrasound for cardiovascular applications, and after that I got the idea that we could do a lot using contrast-enhanced ultrasound for detection of prostate cancer. Why prostate cancer? Well, because prostate cancer is a huge problem. I think that 1 in 6 men is diagnosed with prostate cancer in his lifetime, and nowadays there are actually no imaging modalities, so non-invasive way of detecting prostate cancer. So these patients are actually to undergo systematic biopsies that are blind, so it's a number of biopsies, 6 to up to 18 now, I think, in your hospital, and in just one session to detect the presence of prostate cancer, but not really localize it. So there are also techniques that are nowadays theoretically available for focal treatment of cancer are hampered by the fact that localization is not possible. So the idea was to use contrast-enhanced ultrasound for detection of prostate cancer. Well, cancer growth relates with the growth of a dense network of microvessels. That's the basic idea, and ultrasound contrast agents are really a marvelous technique in order to be able to infer and estimate the structure of these microvessels, even though we are not really able to image them. So what we are doing is to use special models and interpret the dispersion and dilution dynamics of a bolus of ultrasound contrast agent passing through the prostate, and then by doing proper analysis of the wash in and wash out of this bolus, so this amount of ultrasound contrast agent passing through the prostate, we are able to estimate the dispersion kinetics, so the way this content disperses through the prostate, and this correlates with the underlying vascular structure and allows us detecting the presence of prostate cancer, no invasive.
Contrast agents are safe for patients. We have been doing a lot of studies also in the Netherlands, Europe, and as you know, in Europe a lot of contrast studies have been done. And I have never heard of or seen any side effects of contrast, so it's very safe. If you look at prostate cancer, Massimo told that very well. That is, if you are in a department of urology, as I am, what you see is that there are a lot of patients who get prostate cancer, and they are diagnosed with a, let's say, a not so good technique. There is no imaging, so you don't know where the cancer is located. So in most cases, you have to do a lot of biopsy procedures, and the numbers say that about 75% of all the biopsy procedures are unnecessary biopsy procedures. So if the technique of Massimo would increase the reliability of imaging studies for prostate cancer, that would decrease the number of unnecessary biopsy procedures a lot. What means that it would make this technique would also not only benefit the patient, but would also benefit the healthcare system, because you will decrease the costs. And if you understand that during the coming decade, people will get older and older, and that means more and more people will get prostate cancer. At this moment, the costs are increasing and increasing. So by really having a technique by which you can see the prostate cancer, the number of biopsies will go down, the costs will decrease. And furthermore, if you have a technique which can really see where the cancer is located, you can really treat that cancer at that location. And that means that instead of removal of the complete prostate or radiation of the complete prostate, you can think about focal therapy. And again, that benefits the patient because they have less side effects. But what's also important is that it also benefits the healthcare system because, again, costs will decrease. So by injecting some contrast, which is, let's say, something like, 70, 80 or something like that. We will save a lot of money in the end. So that's the reason why I think we work together, because we have a couple of very nice, very intelligent engineers who are developing all kinds of special techniques. And in our hospital and also in other hospitals at this moment, we are really validating these techniques in patients. And I think a unique combination between engineers and people who are working in the clinical field will make sure that all these techniques can really be implemented in the clinic.
Is this something that a doctor could use today?
Yeah, it's very simple. Even engineers could use it if you mean that. It's just a simple injection of contrast into the patient. That's all you have to do to make a contrast-enhanced imaging study. Of course, you need an ultrasound system which can do that, but almost all ultrasound systems nowadays have these contrast capabilities, so that's no problem.
So you could use a conventional ultrasound machine that you buy from any company, almost any company. You
need a little bit of high-end system. That means that you cannot use the very cheap systems, but that's not really a large increase in costs for a hospital or something like that. So, in principle, everybody can use it. There is one but, I think, and that is it could be a problem for non-experienced people in the hospital to really work with all these images of contrast-enhanced ultrasound. And that's also, again, I think the importance of the work of Massimo, because then you will get these nice color images of the prostate, and you see red is where the tumor is located and green is okay. Okay, I have only to focus on the red spot. There I have to take my biopsies, and there I have to treat the patient. So, what could be better?
So
there is one more thing that could even be better, and perhaps that also demonstrates a little bit what we are doing in the Netherlands and also with prostate cancer care, and that is that we now in our hospital for the first time in the world did targeted contrast bubbles in patients for prostate cancer detection. That is the next step, and also we are working together in that field, but the next step will be that these bubbles which now flow around in the blood, also in the prostate, they will have additional molecules on their shell, and that means that they bind to tumors. And then you get let's say a large number of bubbles inside these tumors, and let's say they light up like a Christmas tree, so you can really see where the tumor is located. And by combining the techniques we are now developing with the help of Eindhoven and Massimo with these targeted bubbles, I think that will be